Throughout history, monuments have been created to celebrate the accomplishments of institutions, organizations, and individuals. Architecture can be an expression of historic achievements and the artistic vision of a culture. Structures project a reassuring sense of stability and permanence. Office buildings reflect the contemporary world of business and high technology. The balance of justice is represented by the symmetry of a row of classical columns. Religious organizations also create monuments to their ideals. Towering spires are a traditional call to the faithful, a symbol of humanity reaching to the divine. The opulence of cathedrals represents the riches of a spiritual existence. But what of religious congregations that adhere to a spiritual pathway of poverty and simplicity? What symbols and monuments are created in the wake of its service to society? The Franciscan Sisters of Christian Charity of Manitowoc, Wisconsin, have no shining copper towers, mirrored glass walls, or marble halls. The simplicity of their mother house, a sturdy limestone and brick building on Silver Lake, is a testament to their careful conservation of resources and contributions to the people they have served. A spiritual commitment in response to a calling from God. The true symbol of the efforts of the Franciscan Sisters of Christian Charity is not in the sparseness of the mother house. The monument to their work and lives is the hope instilled in the people they have touched. For nearly a century and a half, the congregation has balanced the simplicity of a Franciscan lifestyle with the demands of providing quality education and health care to anyone, regardless of race, creed, or economic status. The challenge of church and community needs have always formed the spiritual pathway for the sisters as followers of St. Francis. In the mid-1800s, when northeastern Wisconsin was still part of the frontier, the need for schools to educate pioneer children became the first calling of the Franciscan Sisters of Christian Charity. The congregation was founded in 1869 by 5 women under the guidance of a parish priest, with the first convent, a 3-room building, located here in Clark's Mills. The first teaching assignments became tests, not only in their teaching abilities, but of their coping skills as well. 2 of the sisters shared the duties of teaching 190 students at a small school in Potosi, Wisconsin. And if the rigors of teaching weren't challenging enough, consider adhering to a life of poverty in an impoverished pioneer society. There were times when the sisters didn't know where their next meal would come from. Yet they always managed, often through the generosity of the families from the communities they served. The Franciscan sisters have never been disappointed in their belief that through a provident God, all needs are met. The congregation grew quickly as other women, inspired by the work and spirit of the Franciscan community, joined this small group. To accommodate the growing community, a tract of land on Silver Lake was purchased for a new convent. The Franciscan sisters have always relied on creativity to face the challenges that confronted the congregation. But their creative abilities extend beyond problem solving. Many have become accomplished artists and musicians, exhibiting their talents as an expression of their Franciscan heritage. Initially, education was the catalyst for the founding of the congregation. In 1881, however, a new challenge was given to the order. The community leaders in Manitowoc asked the sisters to staff a 12-bed hospital. Recognizing this need, they agreed to undertake the new venture. Human need has always been the motivation for the congregation's decisions, even if it has meant stretching their resources to the breaking point. By 1898, growing demand for medical services for boat crews and the citizens of Manitowoc provided a new mission to the Franciscan Sisters of Christian Charity.